so that, when someone comes with a problem relating to the breast, 9 out of 10 problems are not cancers. Only 1 out of 10 is a cancer.
Especially the sector which breast surgery, which you're already doing in terms of handling patients, but handling your own mother would have been different, isn't it?
Of course. So in the UK, when she was diagnosed, in the UK you're not allowed to treat your own relatives. So my consultant operated on her. So she said that I want to be in India, I don't want to be in the UK. She came back to India and took her chemotherapy, and I realized that we didn't have dedicated breast specialists, we didn't have the concept of breast center.
But what about the medicines to treat? I mean, how is India placed in terms of medicines that can actually help alleviate?
Now in this day and age in India, we are able to offer treatment to the individual comparable to anywhere else, the best centers in the world. Every facility is available not only for surgery, but all the drugs, all the medications are available here.
Welcome to Conversations. My name is Suresh Kochattil. Today I have with us a pioneer in his sector, in his field, who has made a mark. He's been seen often in different channels, speaking at different occasions, and of course, a person who's kind of a legend in his own right. Welcome to the show, Dr. Raghu Ram.
Namaskaram.
I won't speak much. I'll let you do the speaking. You're very good at it. So the question obviously was, I wouldn't ask you why you became a doctor, because your parents would have been your inspiration. They were doctors. I think your dad was a BC Roy awardee.
Yes.
And you also got it, if I'm not mistaken. So that must be one of the rare things where the dad and son both got it. So the early days from Guntur, how was it like, sir?
So I was born in Guntur and raised in Hyderabad, and my entire childhood was in Hyderabad. I studied at Hyderabad Public School, Begumpet, and then did my intermediate at St. Alphonsus Junior College, and finished my medicine in Vijayawada at Siddhartha Medical College. So all through my childhood and intermediate and MBBS, it was happy-go-lucky time when I would be very playful and not very serious about what I was doing in terms of profession and specialization. So the time when the first turning point in my life was when I got a place in Kasturba Medical College, Mangalore, to do my MS in general surgery. So basically at that time, I completed my MS in 2.5 years as opposed to the 3 years.
3 years.
Because that was the last batch that got recognition if someone was to do senior house job in a recognized institution. So I had done 1 year of senior house job at Osmania Medical College. So I completed my MS and topped the batch, obtaining first place in the MS General Surgery University examination from KMC Bangalore. And so it's that was my first turning point. And in fact, I'm going there in the next week as a chief guest for the College Day ceremony, where I'll be conferred the Distinguished Alumnus Award as well. So it's a very humbling experience.
They're very proud of what you achieved in life from their institution. So in a sense, like doctors being doctors, they take a pick a choice at a certain stage in life, saying when they want to specialize in. Usually it's when you do your postgrad, you decide that I want to get into this sector. What made you take up the sector that you're handling right now in terms of breast surgery? And can you talk us through how was that decision taken?
So since childhood, because both my parents were doctors, my father a surgeon and my mother was a gynecologist, so I've always wanted to be not only a doctor but a surgeon. From my childhood days, I would see patients coming home. My parents used to have clinic at home. So they used to see patients, and patients would come with a lot of distress, with a lot of anxiety, with a lot of problems. And a few days later after surgery, they would come home with sweet packets and a bouquet as a thank you. So it really inspired me that you can bring about a transformation in someone's life. And therefore, I wanted to be a surgeon. And so when I had the opportunity after finishing my MBBS, there was no wavering. I wanted to do surgery, and I could not get a seat in my region, I missed the seat by 2 marks. So my parents didn't want me to waste a year. I wanted to, take a step back and prepare and take the entrance examination again. But they said you don't need to waste time. So that's how I did my post-graduation. And then I went to the UK because I had a fire in my belly to obtain FRCS, which is Fellowship of the Royal College of Surgeons.
Yes.
And in those days, the pass rate was only 10 or 11%. So I went to the UK and completed my FRCS not from 1 but from 3 colleges in a span of 2 months. So within a span of 2 months, in between April and June 1997, I obtained FRCS from Edinburgh, Glasgow and Ireland. It was a record and is still a record to pass the exam from 3 colleges, satisfying about 75 examiners. So then breast surgery in the UK was evolving as a distinct subspecialty. And I took an interest because my first job was in a professorial unit at Cardiff in University Hospital of Wales, where the professor was a world-renowned breast surgeon. So my first posting was there, and I was inspired by what he was doing, and he was a pioneer in what I was just mentioning to you about sentinel node biopsy. Became a standard of care after his trial, which is called the Almanac trial. So, and many other trials which have emanated from Cardiff. And so over a period of time, as I observed breast surgery becoming a subspecialty, I got a opportunity to do higher surgical training in the UK, which is a 6-year training program which leads to a consultant position in the UK. And in the final 3 years, one can decide which subspecialty one chooses. And I chose breast surgery, and I had the opportunity to work at several world-renowned breast centers of excellence. And that's how I developed an interest and got trained. And as destiny would have it, my parents came on a holiday in 2002 when my mother was diagnosed with breast cancer in the UK. And that's when, that was the second major turning point in my life to decide, because I was getting into a position where after finishing my training, I would be a consultant breast surgeon, and my wife was also doing very well. She completed her subspecialty training in fertility, and she was offered a post in Harley Street. So we had everything going for us, but being the only child, me and my wife decided that we should relocate back to India. So we came back lock, stock, barrel to take care of my mother, my parents, and to serve my motherland.
How was that experience? Because I've undergone that same trauma of it, and it's a life-changing event, if you can ask. But being a doctor, I guess you can take it more because you've seen it, done that, everything out there. And especially the sector which breast surgery, which you're already doing in terms of handling patients. But handling your own mother would have been different, isn't it?
Of course. So in the UK, when she was diagnosed, in the UK, you're not allowed to treat your own relatives. So my consultant operated on her. After the surgery was done, she needed chemotherapy, and she was very particular to come back to India. And her mother was here, so she said that I want to be in India, I don't want to be in the UK, because both of you will go to work in the morning and come back in the evening. I need to be with my mother. And so she came back to India and took her chemotherapy, and that's I used to come frequently, and that was the time I was inquiring as to how breast cancer care is delivered in India. And I realized that we didn't have dedicated breast specialists, we didn't have the concept of breast center, the advocacy, that is about the awareness about the importance of early detection, hardly was there, and breast surgery was not a subspecialty. So I felt that I must come back, and it was not an easy decision because we have everything going for us in the UK. In fact, my parents told me not to come. In fact, the words they used is, you'll be coming back from an organized society to a society where you have to find your roots, and you want to start something new. There'll be a lot of hassles. Why don't you stay there? So my only question to them is, will you come to the UK? So they said no. So when they said no, our answer was clear. So we said we wanted to come back, and I'm very fortunate. My wife also was rock solid behind this decision, because I couldn't have taken that decision myself, because we have 2 kids, and so we did the planning of relocating in phases. Normally a lot of people come back lock, stock, barrel in one go. We didn't do that. So first my older son came here because he's very attached to my parents. We wanted to make sure he settles down because he was under the age of 10. Then my younger son came, then I came, and then Vyjayanti came. So that it was a phased migration. So I could help Vyjayanti. And so when I came back, I came with not just to work as a consultant, but to make a change apart from taking care of my parents. The 4 things I wanted to do in India: one was to set up a dedicated center for breast diseases, which is at KIMS hospitals, and the hospital management, normally any hospital management in India will not allow a private name to be associated. So I was very keen that my mother's name to be associated. So it's called, they very kindly agreed, Dr. Bhaskar Rao is the chairman. It's called KIMS Ushalakshmi Center for Breast Diseases, and I'm ever grateful to him. So this is not just a cancer center, but a center that is dedicated to the management of breast diseases. So that, you know, when someone comes with a problem relating to the breast, 9 out of 10 problems are not cancers. Only 1 out of 10 is a cancer. So the aim of the breast center is to reassure the vast majority of women who are well but worried well, and treat those who have cancer in one place by a dedicated team of specialists who have been trained in the management of breast disease. So that breast center concept we brought about in India. So the second was, of course, very dear to my heart, was to create that much needed awareness about early detection, because more than 60% of women in our country present in advanced stages, and sadly many of them succumb within a year of being diagnosed. So the key to survival or long-term survival is early detection. So through a number of unique initiatives over the past 18 years, the foundation established in my mother's name, Dr. Ushalakshmi Breast Cancer Foundation, we created a lot of awareness through this Pink Ribbon campaign, through doing Pink Ribbon Walk, illuminating monuments in pink, getting celebrities who have had breast cancer to come and speak, and launching a publication, quarterly publication called Pink Connection, which reaches out to gynecologists and various other people, and various other initiatives. So we've been able to break that taboo or the closet issue in urban India. So the third aim was, what applies in urban India doesn't apply in rural areas. We can't have screening mammograms in rural areas, because 70% of our population live in rural India, where they don't have facilities for mammography, they don't have radiographers, there aren't enough radiologists. So therefore, we have to find Indian solutions to Indian problems. So what we did is, we partnered with the government of Telangana and Andhra Pradesh, trained the healthcare workers who are working with the government to examine women's breasts, which is called clinical breast examination, CBE. By that method, we can detect breast cancers at an earlier stage, not necessarily very early stage, because a mammogram can pick up a cancer as early as 5 millimeters. But with 2 centimeter lump, we are able to pick up if the healthcare worker is trained. So to cut a long story short, over a 4-year period between 2012 and 2016, we have been able to train more than 3,000 healthcare workers working with the governments of Telangana and Andhra Pradesh, and about 200,000 underprivileged women spread across 4,000 villages in both the states were screened for early signs of breast cancer, this clinical breast examination based screening method. And if there was any lump that was found, they were referred to a district health official who would take forward the investigation. So once this became a success here, I had written to the Prime Minister, who put me in touch, in fact, with the Union Health Secretary, and I was incorporated into the decision-making body or the technical advisory group set up by the Government of India in 2016, where this clinical breast examination based screening program, this large-scale screening program that we implemented in the Telugu states, this has become part of the national screening program being undertaken by the National Health Mission, along with cervical cancer and oral cancer screening. So that's a big big satisfaction. And fourth aim, obviously in my professional lifetime, I'd like to see breast surgery evolve as a distinct subspecialty. And to that extent, I garnered support from like-minded colleagues and we were able to establish the Association of Breast Surgeons of India, which represents surgeons, plastic surgeons, general surgeons, and surgical oncologists practicing the art and science of breast surgery, so that we're able to standardize the delivery of care in this country. And hopefully, one day this becomes a subspecialty.
In fact, that's one of the questions which I want to ask you already answered in terms of the awareness about breast cancer, because as you rightly said, 70% of India lives in the villages, and women there have a lot of other priority than bothering about this. Even urban, it's no good actually, no different. Yes. But as you said, early detection counts. But in a country like India, unless you go to them, they don't come to you. There is no thing like health check regularly being done. And he said two of the most important cancers that impact women, one being breast, other being cervical. The government of India also said that we're going to do a screening across the country. Nirmala Sitharamanji announced that in the budget. So the question would be, in terms of taking care of millions of women, do we have the necessary infrastructure? Tracing them, tracking them, and screening them is good enough. But then comes the time when you realize that it costs money to do all this, to do a surgery, and maybe there is about 5% who have insurance, other 95%, out of which say 30% would be having state government insurance. But how do you take care of the cost involved in this particular one?
Okay, so there are two aspects to this. One is detection, second is treatment. As far as detection is concerned, still by far the best way to detect breast cancers is by way of screening mammogram, which, as I said, can only be applicable in urban India. In rural India, you can't do. So clinical breast examination is the way forward, and it is being implemented across the country through the National Health Mission. But what will be the future is liquid biopsy. That is just a blood test using certain, the blood test is based on there are several ways of doing this blood test. Several trials are being undertaken, but the mRNA-based liquid biopsy seems very promising. In fact, we are involved in doing a major trial, and it's very promising. And if it really is going to be beneficial, that is, it should be cheap, it should be available, it should be accurate, it should be accessible. And this is much more acceptable than a mammogram, because it is associated with a little discomfort. Whereas a blood test, you can do it even in rural India. If the blood test is positive, then they can have the mammogram. So that's probably the way forward, although it's not standard of care at the moment. Coming to treatment, now the state government has Arogyasri, which accepts all forms of treatment: surgery, chemotherapy, radiotherapy, and in fact anti-HER2 therapy as well is included in the Arogyasri. And the Ayushman Bharat also has really been a game changer in terms of providing cancer care to those who can't afford.
You've seen women usually, the misconception, or maybe it's a kind of general thinking, is that elderly women get breast cancer. But I'm told of recent times, it is even the young women who get it. And many often than not, when you get a cancer, the first question you ask is, why me?
Yes.
What must be the reason? One is we can understand a genetic reason, coming from parents or grandparents and downward. But then even I believe that is also kind of being overtaken by people who have absolutely no genetic link still getting breast cancer. What, according to you, doctor, would be the reason for that?
So any factor that increases the exposure of the hormone estrogen for a prolonged period of time on the breast can potentially cause breast cancer. So the biggest risk factor is a lady, being a woman. Obviously men also can get it, but being a woman, the commonest risk factor. Second is previous history of breast cancer. These are the two biggest risk factors. And there are other risk factors which is coming into play in this day and age, the lifestyle changes, like late marriages, not having children, having the first child after 30, not breastfeeding, obesity, alcohol consumption, smoking. All these factors increase the exposure of the estrogen hormone on the breast. And compared to the West, where breast cancer is more common after the age of 50, in our country we see breast cancers a decade earlier at least. So the peak incidence of breast cancer in our country is from 40 to 60, at least a decade earlier. So the genetic factor, as you said, is also an important factor, but just because my mother had breast cancer, it doesn't mean my children will have. So genetic predisposition occurs because of abnormalities in the BRCA1 and BRCA2 gene, which occurs only in 5 to 10% of cancers. That is, if there is a close relative who has had breast cancer under the age of 40, or 2 or more close relatives who have had breast cancer in the immediate family, or breast cancer and ovarian cancer in the immediate family, or male breast cancer in the immediate family, they constitute risk factors in terms of genetic factors coming into play, and the abnormality, the BRCA1, BRCA2 abnormalities being positive, that is abnormal, causing genetic induced breast cancer. But it's not common. It's 5 to 10%.
So would gene testing help in kind of detecting these early, doctor?
Yes. So only when there is a strong family history, significant family history we call, as I just alluded to, that is when, you know, they must be genetically counseled. They must have genetic counseling, the patient and the spouse, because willy-nilly getting the genetic test done should not be done, and just the urge to get the test done should not be done, because the implications are quite enormous. So only when there is a strong family history, after genetic counseling, they should consider getting the genetic test done, because the options for treating patients or someone who is BRCA1 or BRCA2 positive, there are various ways. So that needs to be discussed with the person before undertaking this test.
One of the things doctors usually, I'm speaking specifically about breast cancer here, is that women usually tend to be kind of scared of it. Oh, I got it, so better avoid it. As you said, late detection comes in that. And in India, even if you go to them, you know, they usually shy away from it, saying, no, I'm perfectly okay. Heart attack always comes to the other person. Cancer comes to the other person, not me. Till it hits home, then you realize that you are also at risk, and that is, by then it may be too late to treat it. But in terms of survival, which you spoke about earlier, what is the usual survival? When does the stage become really dangerous? I want to focus on this because I want to tell women, look, it's better to be safe than sorry. So what's the stage like, doctor?
So you're absolutely right. It's a closet issue, and also an issue that we don't want to talk about. And that is the reason we have been creating that awareness. In fact, we had a celebrity today at our breast center. And when I said that, you know, someone like you, when you go out after having a mammogram, when you say that you've had a mammogram, they would take you seriously, much more than what they would when I say. So she said, no, we must do this. And then she said, we will do an Instagram or a Zoom related awareness program. So we need to create that awareness even amongst the educated. Even amongst the educated, people leave it till late. So the ideal stage when we should be able to detect breast cancer is very early. That is, before the lady or the doctor can feel it. That is called screen detected cancer. So that is, after 40, a woman walks into a breast center or a center where they get a mammogram done, and if there is a lump, very, very small, that is 5 millimeters or 10 millimeters, it can be picked up. So detecting such a small lesion by way of mammography is called screening, screen detected cancer. So that when someone is diagnosed with such a small cancer, then we can safely say that this cancer is curable. Normally you can't use that word cure in cancer, but when we detect a cancer at a screen detected stage, we expect with modern day treatments, which does not need to even involve removing the breast, not removing all the lymph nodes, just a few lymph nodes, and sometimes, many times if the tumor is hormone receptor positive, then they will not need chemotherapy as well. So with less intense treatment, very good survival, and we expect such women to succumb to old age and not cancer. Confidently. And stage 1 cancer is cancer that is confined to the breast, and stage 2 is cancer that goes to the lymph nodes. So these are early stage cancers, still potentially treatable, very effectively treatable, and we expect that with good treatment the cancer will not come back. But with advanced stages, that is when the cancer spreads to the liver, spine, skeletal metastasis, liver metastasis, and lung metastasis, and brain, because it can potentially go to these places. That's when it's called advanced breast cancer, and survival is limited.
Doctor, in terms of the surgery, you've spoken extensively about it, but what about the medicines to treat? I mean, how is India placed in terms of medicines that can actually help alleviate along with the treatment process? How far are we progressed? Are we still dependent on international pharma companies to deliver those products in India?
Yeah, so just to take a step back, breast cancer has essentially 5 modalities of treatment. The first is surgery, the second is chemotherapy, the third is hormone therapy, the fourth is radiotherapy, and the fifth is targeted therapy. Not everyone will require all these therapies. A multidisciplinary team will decide and personalize the treatment. Now, in this day and age in India, we are able to offer treatment to the individual comparable to anywhere else, the best centers in the world. Every facility is available, not only for surgery, but all the drugs, all the medications are available here. Some of the medications are expensive, some of the medications are made in India. So over a period of time, I think, the medication cost also will come down, but certainly all the drugs that are available in America or in the best of the centers in the world are available here. So in fact, a lot of patients come to us from outside India to get treatment done.
You have won numerous awards and accolades. Is there any specific, it's like asking who is your best child among the two of your kids, but still, there's some award which you feel that, wow, this is something different that I got. Forget your degrees, forget your professional qualifications. I'm talking purely from perspective of somebody who comes up and, as I say, give you a box of sweets also, that's good enough, but an award that you got which recognizes your talent or recognized your talent as such.
So, but I would like to say that the best award that I have got is returning back to India and an opportunity to serve my motherland, because even if I was in the UK for a lifetime, the satisfaction of serving, being able to look after your parents,
that's true,
to be able to serve your motherland and to make a meaningful difference in a country where I was born and raised, has given me the greatest satisfaction, and that is the greatest reward for me, because no other reward can replace me being with my parents and taking their blessings on a daily basis, and for my mother to see the impact that the foundation and the breast center has created. That apart, if there is an award that I'm really grateful, that is the Padma Award. It is one of the highest civilian awards of the land. To be one of the youngest surgeons in the country, to be conferred this award that I really cherish, in addition to 2 other awards, which is the Dr. B.C. Roy National Award, which is the highest award that can be achieved by a doctor practicing in this country. And of course, having replicated the best of British practices in an earnest endeavor to improve breast cancer care in India, I was conferred the Officer of the Most Excellent Order of the British Empire by Her Majesty the late Queen Elizabeth, which was conferred by the then Prince Charles, who is now King Charles. So these 3 awards are very close to my heart, and I am ever grateful to the divine force for this recognition.
Doctor, as we close this conversation, there are thoughts among women, is it the fast-paced lifestyle that we have? Is it the junk food that we have? Is it the exposure to pollution that we have? That also may cause cancer. I'm not just specifying breast cancer, maybe it's one of the reasons. But do you think, what is your word of advice for today's generation? Because forget the ones past 40, they may have it. But at least the ones who are growing up in a culture which is radically different from where we grew up, what is your word of advice for them to take care of their health? Everybody would say, don't eat junk food, don't eat this, don't eat oil, don't do all that. But is there a way one can reduce? I know it can't be totally eliminated, but reduce the impedance of cancer in women.
So essentially, coming to breast cancer specifically, there's no way we can prevent cancer and in fact breast cancer. So there's two advices that I always give. One is women of all ages, if they notice any new changes in the breast, like a painless lump in the breast, or a blood-stained nipple discharge, or any excoriation of the skin around the nipple areolar region, or dimpling of the skin overlying the breast, they must not ignore. They must go and report to a specialist and get themselves investigated by way of triple assessment. That is, the doctor examines mammogram, which is an X-ray of the breast, and an ultrasound-guided biopsy if there is a lump. So one is being aware, breast awareness. Second is women 40 years and over must get a screening mammogram every year. That way, we are able to pick up breast cancers very early before the lady or the doctor can feel it. And with these two ways, we are able to address the issue of breast cancer, detect it early, and ensure a very good long-term survival with good quality of life.
Dr. Raghu Ram, when you speak on, I wish we could go on for hours, because it's like sitting in a master class and listening to somebody who's an expert, who's been there and done that. But I guess time always prevents that from happening. But it was a wonderful conversation with you, and I'm sure the women who are watching it, even their husbands or even the relatives, even the moms who are watching it, will surely pick up some things from you, which gives early warning signs to get a mammogram done, and at least kind of make sure that they're not being afflicted with what they suspect it is. Thank you for speaking to us, HYBIZ. Thank you very much, sir.
Thank you very much. Namaskaram.
Namaskaram. Ladies and gentlemen, that was Dr. Raghu Ram, a pioneer in breast cancer surgery, a gentleman who decided to come back to his motherland and serve his mother and motherland. And to sure, he has achieved many things which many people aspire for. But I'm sure he's not resting on his laurels, and there are many more to come. Maybe a time later, we'll speak to him again and understand his future journey and how things have progressed from the time we last met. Thank you for watching. Jai Hind.